Welcome to another career education and mental health literacy class with me, Mrs. Poro. I'm grateful to be here with you on the traditional ancestral unceded Stolo territory of the Chilkoyak, Palalt, and Samath peoples. This lesson is about how to be there. Just talking about mental health isn't enough. We need the knowledge, skills, and confidence to step up and be there for one another. Lesson content, videos, and ideas come from BeThere.org and BeThereCertificate.org, which were created by a partnership with Jack.org and Lady Gaga's Born This Way Foundation. If you're interested in learning more about how to be there, you can complete the Be There certificate program online. Let's start with a video introduction to the 5 rules for being there.
When it comes to mental health, we all have good days and bad days. And on our bad days, we just need some extra support. We need someone to be there. Now, being there isn't about fixing someone, although I think it's natural, it is for me, to want to fix the things that our loved ones are going through. That's really not what's helpful. What is helpful is just being there, showing you support them, listening to them. Now, you'll know if someone you love is struggling if you see changes in their thoughts, feelings, and behaviors that are intense, long-lasting, and having a negative impact. And if someone you love is struggling, there are 5 Be There golden rules that you can follow. And they're say what you see, show you care, hear them out, know your role, and then connect to help. Now you can use one or more of these rules in whatever way makes sense. Be There is going to teach you how to use them in everyday situations.
It can be hard to tell whether someone is struggling with their mental health or just having a bad day. Everyone has ups and downs, but a good rule of thumb is to reach out and be there for someone when you notice something is different. Maybe your friend isn't laughing as much as they used to, or maybe they're skipping class. If they aren't just themselves lately, there's no harm in checking in. Generally, if someone's struggling with their mental health, they may have some warning signs that you can recognize after these series of lessons. We are especially concerned when their behavior, feelings, or thoughts are intense, stronger, or more persistent than usual ups and downs. If they are long-lasting, usually 2 weeks or more, is really concerning. And if they're negatively affecting their daily routine, relationships, or responsibilities. Learning and recognizing these signs is important so we can start a conversation and get our loved ones the help they need sooner rather than later. Let's take a look at this scenario. A classmate is feeling so anxious about an upcoming exam that they're nauseous and have barely eaten all week. You can decide if this change is intense, long-lasting, and having a big impact. You can pause the video and look at the criteria. If you decided it's intense, that is correct. It's normal to be nervous for an exam, but being so anxious you can't eat is definitely beyond the regular ups and downs of life. Long-lasting? No, not yet. Since it's less than 2 weeks, it's not categorized as long-lasting, but that doesn't mean there isn't cause for concern. Is it having a big impact? Yes. Her anxiety is stopping her from eating meals, which should be part of a healthy routine. Here's another example. A friend calls themselves a total failure and refuses to hang out with anyone for 3 weeks after being cut from the baseball team. Is this intense, long-lasting, and having a big impact? What do you think? It is intense because being temporarily disappointed, upset, or even angry about not making a team is understandable, but feeling like a total failure for weeks on end is more than the regular ups and downs of life. Long-lasting? Yes. This change has lasted for more than 2 weeks. Having an impact? Yes. Not hanging out with friends will have a negative effect on their relationship. BeThere.org has 5 rules for how to be there for others. Now that you can recognize the warning signs, it's important to be able to start a conversation and get our loved ones the help they need earlier rather than later. In today's lesson, we're going to look at the first 3 rules. Be There rule number 1, say what you see. Let's hear Charlotte's story to see how she was helped by the say what you see strategy.
It can be intimidating the first time that you talk to someone about their mental health. You might be worried that they might not take it well, or they might get defensive or angry. The most important thing to remember is to not judge and not make assumptions, and the way that we do this is by saying what you see. So by this I mean, I had an experience where I had a friend who noticed that I was struggling with my mental health, and they said, "Hey Charlotte, I noticed you haven't been coming out with our friends as often as you usually do, and that's not really like you. I wanted to check in because I care about you. How are you doing?" And that really opened the door for me to have that conversation. Even if, you ask that question and the person isn't quite ready to talk yet, you're at least making that space for them to come forward when they're ready. And if they are angry or if they do get defensive, just remember that it's not a personal thing. It's just scary to talk about your mental health sometimes, and they might not be ready.
Say what you see. What to say. Here are some tips. First, stick to the facts. Don't judge. Don't make assumptions. Just say what you see. Starting the conversation may seem really daunting. That's okay. We get it. But it's easier than you think. Just tell them what changes you've noticed and ask if they're okay. For example, "I've missed you at soccer the past couple of weeks. Is everything okay? You've been quieter than usual the past few days. Is there anything you want to talk about? You've been so busy lately. Are you taking time to eat? I miss having lunch with you." All of these are examples of simply saying what you see. What if it gets really awkward? Yeah, it might, but there are a few strategies you can use. First of all, embrace the awkward. We'll take the uncomfortable conversation over staying silent any day of the week. Secondly, stick to say what you see and let them know you care. Count this moment as one of the many awkward but worthwhile moments in life, like first dates, braces, mistaking a high five for an elevated handshake, and so forth. If they don't want to talk, don't take it personally. Despite our best intentions, these can be tough and upsetting conversations. You can't control someone's emotions or responses, nor should you try to. If someone is getting upset or starting to panic, take the hint and ease off. Rule number 2, show that you care. Sometimes just knowing that someone is there for you can make a world of difference. Showing you care can create a safe environment for that person, allowing them to open up and feel comfortable enough to talk things through. Part of being there for someone is also finding practical ways to help get them through their day-to-day life. Let's hear a story from Muhammad about this.
Letting someone know you care is a great way to be there for them. But don't just say you care, show you care. If your friend misses class, send them your notes to help them out. Or if they're anxious about walking alone at night, offer to walk with them. But don't assume you know what they need. Sometimes you can just ask them, "How can I support you better?" Showing you care builds trust in a relationship, and it helps them get through their day-to-day.
Part of showing that you care is creating a safe environment. Everything you do and say is a little clue to the people around you as to how approachable and trustworthy you are. Being critical of someone, like making comments about their weight or clothing or accent, might suggest you'll be judgmental of someone's mental health struggle. Be inclusive, don't judge, not just when someone's struggling, but all of the time. Be compassionate, helpful, and be a good listener in your daily interactions. All of these things signal to others that you care about people and you're a safe person to reach out to. Be trustworthy. Don't gossip about people with others. Your actions speak louder than words. When hanging out, put your phone away and be present in the moment. Don't rush the conversation. Keep it simple. Sometimes a glass of water, some food, or just a safe place to relax can help a conversation along a lot. You can offer practical help like doing homework together, sharing notes, making a snack, or going with a friend to see a counselor. Anticipating their needs can help you show that you care. And remember, everyone is different, so it's important to ask how you can help. Ask them what they need, and then really listen to what they say. Let's take a look at an example. A friend you know struggles with anxiety, had a bad day at school, and is obsessing about a big exam tomorrow. How can you show that you care? Pause the video and see what you can come up with. How many of these did you come up with? Rule number 3 is hear them out. Listening is the most important skill when being there for someone. We need to learn to balance the conversation. Most conversations are a mix of listening, asking questions, and sharing your thoughts or experiences, prioritizing these elements in that order. Let's hear some tips from Ashley.
You've started the conversation, now you need to hear them out. But listening is a skill and it is not always easy. You can start by asking open-ended questions, just to get them talking, and be patient. Also, make room for moments of silence. They're valid too. Sometimes, offering advices or even sharing about your own personal experiences can be helpful. Just make sure to keep the conversation about them. And if you don't know what to say, it is okay to just listen.
Listening is pretty simple, but we all get it wrong sometimes. We try to fill in the awkward silence or fix problems by offering advice. That's not really listening. Body language is super important. Making eye contact, uncrossing your arms and leaning in, nodding occasionally, not so much your head looks ridiculous. Allowing space for those awkward silences and allowing them to collect their thoughts is important. Paraphrase and summarize their thoughts back to them. Validate their feelings. You can say, that sounds really hard. I can see how frustrating that could feel. Don't say things like, you are overreacting. That does not validate their feeling. Remember, this conversation is about them, not you. Let's take a look at an example of a discussion between Allie and Sarah. Allie says, I don't know what's wrong with me. I feel tired all the time. Based on our tips so far on the first 3 rules, how should Sarah respond? Pause the video and figure out what you think is the best response. The best response is sound rough. How long have you felt like this? It validates Allie's feelings, builds trust, and asks an open-ended question that can help Allie to open up more about his issue. The conversation continues. Allie says, I don't know, a few months, ever since, never mind, I know you're busy. How should Sarah respond to that? Pause the video and choose what you think is the best answer. Well, the first answer jumps right to advice when Sarah doesn't even really know what the problem is. The second answer, I get it, hang in there, it'll pass, doesn't really validate Allie's feelings. Kind of brushes it off and says everything's going to be okay. The third answer is the best answer because it shows that Sarah cares and it asks a follow-up question, showing you're listening and trying to understand what Allie is struggling with. Remember, if you or someone you know is in a crisis, you can call a helpline or 911 or emergency services or go to your nearest emergency department for assistance. In this lesson, you've learned to recognize the warning signs for behaviors, feelings, and thoughts. You learned that if they are intense, long-lasting, especially if they're more than 2 weeks long, and impacting behavior, that they're warning signs that should be taken more seriously. You've also looked at the first 3 of the 5 Be There rules from BeThere.org. Say what you see, show you care, and hear them out. Your task this week. In Teams, you will complete the form called Mental Health Literacy 7, Be There Part 1. You can revisit this video and the lesson notes as needed. It's okay to work with a friend or classmate, but you must each submit your own form. Possible, complete this in class today. That's it for this week. Have a great week.